Imagine discovering there's a medicine that could save your life, but you can't even afford it. For millions of Americans, that isn't a hypothetical, it's a reality. Hi everyone, we are the Stupendous Stock Squad. My name is Sanvi, and we're here joined today with Shrika, Neera, and Nakash to discuss the prescription drug pricing policy in the United States. Right now, Americans pay some of the highest prescription drug costs in the world, often 2 to 3 times more than other people in other developed nations. And because of these costs, many individuals are forced to delay, reduce, or completely skip the medications they need to survive. And so the problem, high prescription drug prices create both an economic and public health issue. Nearly 30% of Americans report skipping prescribed medication because of cost. For essential drugs such as insulin, prices have risen dramatically over time, making long-term treatment difficult for many families. And when patients can't afford their medications, their conditions often worsen, and this leads to more emergency visits, more hospitalizations, and ultimately higher healthcare costs for everyone, not just individuals. So what starts off as a pricing problem becomes a larger, systematic, wide healthcare problem. One solution economics often discussed is a price ceiling, which is a government-set maximum price often placed below the market equilibrium. The goal is to make prescription drugs more affordable and accessible, especially for those essential medications. In the short term, this can help more people afford the drugs they need. But economics also shows a trade-off. When prices are forced down, demand increases, while supply may decrease, potentially leading to shortages. Over time, lower profits could also reduce incentives for pharmaceutical companies to invest in research and development, which may slow the creation of new treatments.
Although price ceilings can make prescription drugs more affordable, they also create important trade-offs. In the short term, lower prices improve affordability and allow for more patients, especially low-income individuals, to access to necessary medication. Because prices are lower, more consumers are able to produce prescription drugs, which can improve health outcomes and reduce financial stress. However, these policies can also create long-term problems. As pharmaceuticals companies earn lower profits, they have less incentives to invest in research and development. Some firms may reduce supplies, leading to shortages and limited drug availability. Over time, this can slow development of new treatments and cures. This creates a major challenge for policymakers, balancing affordability with innovation. To really understand this challenge, it's important to recognize how expensive and risky pharmaceutical innovation really is. When governments impose price ceilings, companies earn less revenue per drug sold. Lower revenue leads to lower expected profits, which can cause firms to reduce investments and development. As investments decrease, fewer new drugs are developed over time. This is especially important because more drugs fail before reaching the market. In fact, only around 10% of drugs entering the clinical trials are approved. Developing a single drug can cost billions of dollars. Because of this high cost and risk, pharmaceutical companies rely on profits from successful drugs to fund future research and innovation. For this reasoning, strict price controls can unintentionally threaten innovations that support innovation. Developing a new drug can take over 10 years and requires billions of dollars in investments. Since a small percentage of drugs succeed, companies depend on profits from successful medications to recover losses and continue funding future development. When price ceilings reduce expected returns, firms are less willing to invest risky research projects. As a result, fewer new treatments are developed and long-term medical innovation slows. Because of this, policymakers should focus on solutions that improve affordability while preserving innovation incentives for future drug development.
Thesis. It's easy to see that price ceilings have both pros and cons. However, it's important to realize that by using price ceilings, we risk undermining the constant innovation that happens in the United States pharmaceutical drug industry that makes us such a leader in pharmaceutical drugs. Therefore, the Department of Health and Human Services should seek to expand subsidy programs such as Medicaid or low-income assistance programs where the government directly helps cover the costs for these necessary drugs for the people who can't afford them. This allows the market price to stay intact, which preserves the innovation incentives for so many companies across the country while ensuring vulnerable populations still have access to their needed prescription drugs. In order to thoroughly achieve our solution, we will have an important 4-step process. The first step is laying the foundation. We must start by broadening the amount of people who qualify for Medicaid coverage by changing the federal property level percentage from 138% to 300%. This means the current $25,000 annual income threshold to receive full Medicaid eligibility will be raised to an annual income of $48,000. This standard will be reflected across all 50 states. Step 2 will be to establish the fund. This step involves establishing a Health and Human Services fund that subsidizes the out-of-pocket costs earners earning under $48,000 a year will have to pay. The out-of-pocket costs will decrease by over $850 from the current $2,100 that low-income earners have to pay. Step 3 will be scaling the subsidy. We will create new policies for drug manufacturers like Pfizer and Johnson & Johnson to offer copay assistance debit cards, which assist individuals who are earning under the $48,000 threshold. These can be used at participating pharmacies partnering with these large manufacturers. Step 4 will be to cement and sustain. We will make these listed initiatives into a durable law, allowing the vast majority of low-income individuals to have permanent access to the necessary prescription drugs indefinitely. This will be followed by an establishment of a new department at the Department of Health and Human Services, which will work to sustain these initiatives by addressing gaps in assistance and funding and addressing new economic changes.
On this slide, we want to highlight what is already happening in the real world and why this issue demands further action. So first, policymakers have been taking meaningful steps to address these high prescription drug prices. Through the Inflation Reduction Act, Medicare can now negotiate costs on high prescription drug prices, certain ones. Insulin is capped for Medicare beneficiaries, and out-of-pocket spending limits have been set in place for seniors. These reforms show that the federal government does recognize the urgency of this problem. However, they only apply to a set limit of medications and primarily benefit Medicare patients, leaving many Americans still facing unaffordable costs. So Representative Raja Krishnamurthy is a very important figure in this policy issue. He represents Illinois' 8th District and has built a strong record in oversight and consumer protection with a particular focus in drug pricing transparency. So his overall work in this issue just reflects a broader commitment to ensuring that pharmaceutical companies can justify their price increases. He's led investigations like drug price hikes, pushed for stronger generic competition so we can bring prices down, as well as consistently advocating for affordable insulin, which is primarily what this effective leadership looks like on this issue. And to help push this conversation further, we've actually reached out to him. We've emailed him, we've sent a letter, and in our message, we emphasized that rising prescription drug prices aren't just an economic challenge, but they're a barrier to basic health and financial security for millions of Americans, okay? Families across the country have to choose between either life-saving medications or essential needs, and nearly a third of adults report not taking their medication prescriptions as directed because of the cost, which is a clear sign that our current system is failing many people. So our outreach focused on advocating for balanced, practical legislation as well. We urged him to support targeted price ceilings on essential medications where competition is limited, while being paired with measures that prevent shortages and maintain a stable supply. We encouraged expanding federal investment on biomedical research and stronger support for underserved communities, because our goal isn't necessarily to undermine innovation of like new drugs. We just want to make sure that it's affordable for Americans. And by contacting this policymaker, who's already demonstrated leadership in this issue, we are obviously helping to advance a policy solution that can lower costs today while protecting development of continuing treatments. And our hope is that with his support, Congress can move toward reforms that ensure no American has to choose between their health and financial security. Thank you so much for your time, and we hope that our analysis and outreach efforts show that meaningful, balanced reform are both possible and urgently needed.